Hello, everybody. Welcome. This is Joanna. I'm going to give everybody a couple of minutes, maybe one, to join today's webinar, and then we will kick it off in earnest. So welcome. Get yourself settled. We will be asking you guys for your questions and your feedback throughout the webinar. Feel free to start chatting with us now by telling us where you're from if you'd like to. You can use the chat or the Q&A boxes here on this webinar, and for questions, if you could pop them in the Q&A, it will be easier for me to be able to see them as they pop up. So welcome, and we will get started in a sec. Excellent. Texas is in the house. It feels like Texas here in New York today, so it's incredibly hot. But welcome. Okay, you know what? I'm going to get started. So once again, thank you all for joining. Special thanks to our guests who are going to be the main focus of today's conversation. Oh, there's an echo on my computer. Are other folks hearing that? All right, I will keep going. I'm not seeing other folks. I'm sorry about the echo if you're experiencing that. Okay, I will keep going. So I am excited today that we are celebrating this year's Best in Building Health winners, and kicking off these conversations with two of the companies who have really featured in Best in Building Health since the beginning of us recognizing these awards, and been with us on this journey since the beginning of Fitwell, which I can't believe is actually 10 years. It wasn't launched to the public 10 years ago, but we received the contract from the CDC 10 years ago, which is really crazy, but a good moment to kind of look back over the last decade and the achievements that we have been able to bring about with all of you, our partners. So the companies who are represented today, Gensler and Harrison Street, are two companies who've really been pioneering and leading this healthy building movement alongside us at Fitwell. And we are going to hear from these two very different voices within our real estate industry. Gensler obviously providing architectural services, broad range of services to the industry, and then Harrison Street on the financial side as an equity provider. So great to have this kind of contrast of the two different perspectives of really what does it take to create award-winning projects? What does it take to really lead an industry and lead a movement, which is still in its nascent phase? So I'm excited to have both of our guests today to share their perspectives. And as I said, you're welcome to ask questions and join in the conversation, and we would appreciate that. So first, I'd like to welcome Nova, who is coming from Gensler. Gensler, as I said, has won many awards over many years. This year alone, they won 9 Best in Building Health awards for some individual projects, one of which we're going to be talking more about today, which is San Francisco Airport Harvey Milk Terminal 1. Center, I believe, is its official full name. So we're going to be hearing more about that specific project. In addition to winning that project award, Gensler also received the award for having the highest recertification using the V3 standard. And what I'm excited to share there is that this project had 3 stars in the old version 2.1 and was able to maintain 3 stars in the new version as well, which is obviously what we like to hear, but great that they were able to achieve that. And lastly, Gensler also has the most ambassadors of any company for the 3rd year in a row. So lots and lots of things to celebrate, and truly, what leadership looks like from the architectural perspective. So looking forward to more of a conversation there. And then Moira from Harrison Street, welcome. Again, Harrison Street is a company that has been with us on this journey since the very beginning, and actually in many ways shaped some of the scorecards that we offer to everybody today. And we're going to hear a little bit more about how that has developed, how that relationship has developed over the years. Harrison Street have also won many awards, including having the most certified projects in 2025 and having the most registered projects in 2025, as well as some higher scoring projects for a senior housing project as well. So again, both of these companies represent multi-award-winning companies. They definitely know how to design and develop and invest in award-winning projects. So looking forward to hearing more about that. So before we jump into the discussion proper, I'm just going to set up a little bit about where we find ourselves today as an industry and what has changed over the last 10 years. And I think I would boil it down into three main areas that we've seen a lot of change in a decade. And the first is demand. So when we launched Fitwell, I guess 10 years ago, the demand for certification, the demand for healthy buildings was really being driven by investors and by the industry in order to fulfill reporting requirements. So really kind of looking at ESG reporting, GRESB reporting, investor reporting, all sorts of different reasons for reporting. But it was very much a business to business demand driver that folks were using certifications for. What we have seen, certainly since COVID, but even before COVID, that there's been a big shift in the market where now consumers are demanding health promoting environments. And we see this at the workplace where individual employees are really demanding of their employer a health promoting environment in a walkable place with great access to transit. So tenants in turn are willing to pay more for those properties, for those spaces. And then on the residential side, all facets of residential, we're really seeing promoting health as being a necessary part of providing people quality of life that they are demanding. So we're really seeing this shift to a consumer-driven demand for health. And that's, a new challenge. It's a new area, an opportunity for all of us to be able to continue to advance the healthy building movement. So demand has shifted. Financial performance has now become the absolute kind of prerequisite. We really have to be able to demonstrate that promoting health or any of these broader initiatives has a direct impact on financial performance for assets. And that's something obviously we've been working on, and certainly something that Moira will talk about more from Harrison Street's perspective. So it's no longer good enough to say it's the right thing to do, you should do it. We really have to be able to demonstrate this is the financial outcome of really taking this approach. And that has become essential in today's conversation. And lastly, one of scale. When we started 10 years ago, certification was really applied to a single asset, asset by asset. There has definitely been an evolution around how do we scale this approach? How do you have an approach that really allows you to implement certification across an entire portfolio of assets, a whole fund of assets. And that has really become what leadership looks like in today's market. So we'll talk a little bit more about that. So without further ado, I'm going to turn to today's guests and actually really allow them to introduce themselves by giving us a little bit of insight into their own personal journey and how they ended up in this space at this intersection between health and the core businesses that they work on. And to hear that journey from them, I think will also inspire all of you as we're all looking at our, evolving careers. It's always great to understand how somebody has ended up at this particular intersection, because it certainly it wasn't something that was really prevalent in the industry a decade ago, right? This is still a relatively new field. So Nova, I'm going to turn it to you first. Welcome, and love to hear about your journey and what brings you to this intersection of health, sustainability today. Thank you.
Great. Thank you, Joanna. Thanks for the introduction. I would say that my career path has not been a straight line, but the common thread, I believe, is really was the focus on Earth and planet and people. And so my educational background is in environmental analysis and design with a concentration in urban and regional planning. And I previously, in my previous work life before Gensler, I worked with local government with community development and transportation and redevelopment. And then at Gensler, architectural design firm, we're a collaborative firm, really looking at creativity, research, and innovation to help solve complex problems in the cities we work in. And since my time at Gensler, I've had the opportunity to really evolve the work that I've been doing in sustainability and wellness and human health. And you talk about how uh, Fitwell's been around now for 10 years, and I think I started working on leading Fitwell projects in 2018 or 2019. But we've seen it even with our clients and in the industry where I think that sustainability and wellness was more of an afterthought. And what I love seeing now, it's really transformed and is now becoming more embedded and holistically implanted in the design.
Yeah, no, fantastic. I appreciate that. And it's great to hear. So we will continue to pull that thread we continue the conversation. But turning to you, Moira, there's a through line here, and Gensler is the through line. So we'd love to hear a little bit more about your journey so far.
Sure, yeah. So yeah, my career journey really started in the architecture and design industry. So have that connection with Nova. Also, Gensler was one of the firms I worked at, so another fun connection here. I was not a practitioner at any of the firms I worked at. I was working on the marketing and business development side of things. So very client facing, shaping those stories, telling those stories to potential clients. So was marketing several different practice areas, but I think a through line, throughout my career there was telling the sustainability and the health and well-being stories in the projects that we were designing. So that became a passion of mine, and I went on to then, after the architecture and design industry stint, I went on to found a waste reduction consultancy. And so that was more on the sustainability side of things, but I think we all know there's such a discourse around health and waste. So that was still a through line for me. And then about 5 years ago, came on to Harrison Street to really lead the social strategy for our ESG team. So Harrison Street is an alternative real estate investor, and we have very demographic-driven assets. So there is a special opportunity for us in the space of health and well-being. But I would say one theme throughout my career so far is this kind of hunger for measurable data and connecting sustainability and health and well-being to financial performance and the business case around that. So there's always been an an appetite for that, and I think it certainly continues. So
Fantastic. Yeah, no, totally. And I think that data-driven approach has been made possible over the last decade as well. I think, a decade ago, we hadn't collectively as an industry defined a health promoting environment. We didn't have the metrics associated with what good looked like, what success looked like. I think that is something that has certainly evolved over the last decade. And then the ability to then correlate that with financial performance is something that is beginning to be possible today. And I think as we talk about the future at the end of the webinar is something that will become more and more possible as we can bring in these different kinds of data and really overlay them in order to come up with credible connections between these actions that we're all investing our time in around health and wellness and what that means for the core business of real estate, which I believe is the conversation that we're going to be having hopefully for a long time to come. So thank you. So now I'm going to transition into what makes a best in building health project. What does it take to really lead and take the idea? I think everybody sets out with a project or a fund or whatever scale we're working at, wanting to be the best, as you define it, as we all define it. But what does it actually take to take a project from the idea and the intent and actually bring it through all the way to deliver it to the consumers, in the case of the San Francisco airport, an incredibly complicated and incredibly large project. So Nova's going to give us some insights into what it takes to build a project of this scale and do so at an award-winning level. So Nova, I'm going to hand it over to you to give us some insights about Harvey Milk Terminal and some of their success stories, and we always love challenges. So if you want to add a few of those as well, that would be fantastic. So yeah, let me turn it to you.
Yeah, the Harvey Milk Terminal at the San Francisco International Airport is really powerful example of what's possible with, not, beyond Fitwell, but, with human health and sustainability. And not only is it a major infrastructure project in the Bay, but it's also, really great example of what the aviation industry can become as a whole. I had the privilege of working with a large group. So this is definitely, it took a village, partners, consultants, and stakeholders to deliver and for a long period of time. And so that in itself, working with such a big group of people, it really contributed to making this a really successful project. And I think really what is core to this is the leadership at the San Francisco International Airport and their sustainability team. I think their strategies were non-negotiable, especially coming out of COVID, and the fact that you have 58 million passengers coming through the airport annually and about 42,000 occupants at the airport. There was this level of responsibility that's quite significant. And so that's something that, they recognize, we've got to do something beyond code and really pursue certifications like their LEED Platinum and their Fitwell 3-star. And that was their target, really to make sure that, they had understood their responsibility to create a safe and healthy environment for everyone moving through the space.
Sure.
And by pursuing, LEED and Fitwell, it kind of reinforces, or it does reinforce, their commitment to really focus on sustainability and human health. And it also includes a lot of different elements that reflect the climate and culture of the Bay Area, including native landscapes and biophilic elements in the space. But more importantly, it really moved beyond design because it really required the airport to look at their operations. So not only does it impact the Harvey Milk Terminal 1, it also impacts the airport. And working through the Fitwell certification process really supports the airport's to improve its social and environmental and fiscal responsibility as well.
Yeah, great. Hopefully, I think we're having an issue with the slideshow, but hopefully we can get some more images, as architecture is definitely a visual. Excellent. Yeah. Actually, we just were looking at this image and commenting on the fact that it must have been taken during COVID because of everybody's masks. So I think this is also a recertification, is that right? Or it's this is a built certification that followed a design certification.
Yes.
And was the first airport in the world to get Fitwell certified.
Yeah, I think it might be, and correct me if I'm wrong, I think it is currently the only Fitwell 3-star airport and LEED Platinum certified airport in the world.
Yep, that's certainly correct from our perspective. I can't speak for LEED, but the combination is definitely unique. Which is amazing. The number 58 million people a year. I mean, that is unbelievable. The number of people kind of experiencing the space. So I'd love to hear more about this room because I think this is such a great story.
Oh yeah, so this is part of the design team's effort, and I believe it was in partnership with UCSF. So this is the airport's sensory room, and it's really, the intention is to provide like a calming and inclusive and grounding space for neurodivergent travelers and their families. It's a place for them to decompress. I mean, as you can see, it's interactive. There is kind of like the lounge furniture space that allows people to kind of relax, so they can be interactive and work with the artwork or, the interactivity on the walls. And then also you can kind of see to the right, there's a simulated cabin experience. So, for those that may have a kind of fear of flying, it kind of gets them ready before their actual flight. So yeah, and I do want to say that in terms of a lot of the design, I mean, a lot of this effort for getting the Fitwell certification was really embedded even earlier in the design with all the partnerships that it required. And so it made it easier, I would say, to achieve fit well because of all the pre-design efforts between all the collaborators to make these types of space happen. But yeah.
I mean, so you mentioned this already, but maybe we can just delve into this a little. You're really serving two main populations with an airport because it's a huge employer. And those folks are experiencing the airport and commuting to the airport and so on every day. And then you have the passengers traveling through an airport in a heightened stress level, I would say, like folks. So you've got these two different populations. Like how much of that was kind of considered as you were kind of going through the process? I know that's an area you were commenting that we could expand Fitwell specifically for airports, but yeah, I'd love to hear more about that.
Sure. Yeah, I'd love to talk about that. Currently, so for those on the call, the built certification and design certification was through the multi-tenant retail scorecard. So that was the closest thing that is related to airports. So a lot of the strategies were pertaining to a lot of the occupants. So, stairs were kind of this challenge that we experienced because there's the travelers. So having signage for stairs, we definitely don't want to encourage our passengers walking through to carry up a 30 or 40-pound luggage up the stairs. So it was really this balance of creating kind of the messaging and the space for passengers and also for the occupants and the employees. So, there are elements where we're looking at the, indoor air quality, which is important for all, daylighting, important for all, the biophilic elements that are in the space was also really important. But also, you mentioned, the stress reduction, and that applies to both workers and also, people coming to the airport that might be experiencing delays or, might be going through, events in their lives that are really challenging and they have to go to the airport. So it's really nice if they have the time to walk through the space because there are amenities also not only for the employees, but also for travelers, including the sensory room, the yoga room. There's little museum spaces, and there is, and going to airports, I think, and this is something that I hear from friends or people that travel through the airport, it's like they don't even realize what makes them feel good, but when they come in, they really feel great. And I think along with the sensory room, I think there's a lot of viral videos going on TikTok and Instagram, promoting this. So it's really great to kind of see that level of seeing the improved and enhanced experience for people coming through and knowing that it makes a difference to help reduce stress.
That totally makes sense, right? With my comment about consumer demand really kind of taking the forefront in the drive for health, where people now have become much more aware of the role that the buildings that they are working in, living in, moving through are actually playing on their like mental health, physical health. So I think that it's great that folks are picking up on the fact that this airport is different and it makes them feel good. They may not know exactly why, but the fact that they're actually, kind of sharing that is fantastic. I think it just furthers that kind of consumer awareness of what we all know to be true, and that is that buildings really have a big impact on health outcomes. So that's fantastic. Great, excellent. So we'll talk more about Harvey Milk as we progress, but we're now going to change scales basically and chat with Moira about Harrison Street. And Harrison Street really represents a different perspective from the real estate industry as an investor, and obviously your influence can be broad because of the scale that you're working at. So I would love to hear a little bit more about your long-term, kind of Harrison Street's long-term vision, investment thesis, why health has become such an important attribute that Harrison Street is championing. This is one of your award-winning projects from this year. Just so folks know, it's a Brightview Devon complex, which is wonderful project. But we're really going to talk a little bit more about big picture to give everyone listening their different perspective as far as what owners and investors and developers are looking for and why, what's motivating this shift. So Moira, I'd like to hand it over to you to talk about Harrison Street's approach. Thank you.
Yeah, so I would say since the firm's founding, health has really been embedded in our strategy. And I say that because of the demographic-driven asset sectors that we invest in. So things like senior housing, student housing, these sectors are just inherently focused on health. There's care happening in these buildings. There's people living in these buildings. So there really is a special opportunity here and for us. And I think a place where we really saw ourselves able to be leading in this space. So when we decided that we wanted to look for a healthy building certification in order to apply portfolio wide, there really wasn't anything out there yet to help us certify senior housing, which is a really large part of our portfolio. So we had some great conversations, Joanna, with you and your team, and everyone was interested in figuring out, how to make this work and how to get a certification for this typology. And so we, along with a handful of our operating partners, partnered with CFAD to help design what now is the Senior Housing Scorecard. And I think an important aspect of the scorecard I want to underscore is the focus not only on the residents, so not only on the senior population, but the staff in the building. So huge ratio. It's almost 1-to-1 in terms of staff to resident ratio. So there's a huge population of employees in these buildings, and we know that the resident care is really directly related to staff satisfaction and mental health and all these things. So to prioritize those spaces as well as the resident spaces was important for us, and I think remains important for everybody in the industry. So that is now available, and it's what we're using to certify our portfolio. And I think with Fitwell also comes scale and data because of that scale. So we're able to now see a portfolio on the same standard, kind of all A and B seen together on the same scorecard, and are able to see patterns there. And it gives us just a really rich data set to then do more analysis with our portfolio specifically.
Great. Yeah, no, totally. And I think it kind of follows on from the conversation about the airport when we have properties that are really serving two quite different populations, such as senior housing. It was actually an aha moment for me when I was working with you guys at the beginning that actually one of the greatest financial risk factors for senior housing is actually staff retention, and that staff turnover was a real kind of critical piece of the business, which we wouldn't have known, right? It wasn't obvious to me from the outside going in. So I think things like that are really critical in these partnerships where we really learn at least as much from you as you learn from us, if not more, I would say, from all of you guys. So it was, very important partnership to be able to deliver a scorecard for senior housing, which worked within the context of senior housing as well, like not reinventing the wheel of the industry or also all of the existing kind of focus areas that senior housing is already undertaking. And this was done during the COVID time, actually. So there was so much stress and kind of pressure put on this particular sector. You guys also work with student housing, which I think is a really, for me, it's almost like that forward-looking story. If you want to talk about student housing at all.
Yeah. So student housing, is able to really utilize the Fitwell multifamily residential scorecard. It's essentially multifamily residential. At least our assets are with a student population in them. I say that from a design typology, but certainly the demographic in those assets is very unique. I think there's a really special opportunity for us and for design and for policies and things like that related to health for student mental health. And it's a big topic in the last couple of years. It certainly was highlighted with the COVID pandemic. But I really truly think that those are special spaces, and provide a lot of opportunity for us prioritizing the mental health aspect, in that demographic. So yeah.
Yep. No, it makes sense. I mean, we see very strong demand numbers coming from students around
Mhm.
health and sustainability being basically a requirement for them as they're choosing halls of residence and even universities to some extent, which for me is encouraging because it means that our future workforce and future renters and home buyers, this generation is going to carry forward that interest and awareness of the role that the built environment is playing, specifically, as you were saying, on their mental health outcomes, where this generation, I think, are much more keenly aware of and comfortable talking about mental health in a way that prior generations have not been, which I think is obviously good for everybody. I'd like to pick up on one of the things you talked about, which was scale, and have like a conversation about how do you actually scale? It's all very well. Everybody wants to scale, right? Every business wants to scale. It's always about scale. But you at Harrison Street have actually been able to scale using Fitwel across your portfolio. So I would love for you to share some of the tactics that you have evolved over the time, because right, it has taken us together, I think, time to figure out how to do this in a way that's efficient with everyone's time and so on. So if you can kind of address the scaling piece.
Yes. Yeah. And I'll give everyone on the call just some context. We have over 500 properties that we own that are mostly able to be Fitwel certified. So there's a big task at hand. But a special opportunity, and I will say challenge for Harrison Street, is that we're not vertically integrated. So we own the buildings, however, we don't manage them. So we're not the boots on the ground making the policies, things like that. So what we do is really pride ourselves in partnering with best-in-class operators and property managers across the country, and those who are, top of the industry in their specific industries. And it's really been through a collaborative teamwork effort with our network of operators, I'd say, to make this successful. And I think key is it's been a communications exercise. It's been a change management exercise. I think there's a lot of people learning about Fitwel for the first time, in our network. And so just I think not underestimating the time that step takes is key. It may take a little longer than you expect it to, I think certainly in our case, but I think once it is embraced, once it's clicked, once people have maybe a point of contact for Fitwel or a champion of Fitwel within their organizations, I think it really is the key to having it take off. So yeah, there's been a training process, there's been an educational process on our end, across our partner firms, for them to roll out as well to the rest of their portfolios. So something I will say about, Brightview Devon was one of our projects that won the highest score in the senior housing category, this year. And Brightview is a partner that we have a large portfolio with, for example. So they were really integral a couple of years ago, in the conversation around efficiencies during certification and portfolio-wide strategies. And so they really helped us kind of build that process, because we identified quickly and early on that we needed to find all the efficiencies we could figure out to make this happen, in a reasonable time frame. And they were a very big part of that conversation. And then the last thing I'll add is just internally at Harrison Street, internal alignment is huge across different departments. So I sit on the ESG impact team, and we're really driving the initiative, but it requires so much similarly communication, change management across departments, whether that's asset management, transactions, the people inking the deals for the new buildings, building the certification into the budget from the outset has been a way for us to really institutionalize the certification and make sure it gets done.
Great, fantastic. Yeah, and excited to hear that the portfolio-wide strategies, which for folks aren't familiar, are launched now on the Fitwel platform, which really allows you, if you have a consistent strategy, say you have a consistent indoor air quality policy or a consistent integrated pest management policy, always my favorite, that you can now get that approved once and applied across all applicable assets in that portfolio, which obviously makes it much more efficient, especially when you're dealing with the kind of scale that we're talking about today. So yes, lots of efficiencies. And as you can tell here, like this is very much a dialogue between us and the folks, all of you who are using Fitwel. We do not sit where you sit. We don't know what you know. And it really is that kind of collaboration between us and the industry. So that's great to hear that those have been useful and will help to scale. Nova, just kind of building on this client theme, I think that we're just touching on here and what it takes to have these successful projects. I would love to hear more about kind of that evolving client expectation, that involving client understanding of what good looks like, and what that means and what that takes, and how to build on that for these successful projects. If you can give us, I know you talked a little about the Harvey Milk team, but just to build out that a little bit more about the kind of the client's role and how that has evolved over your time working in this space.
Sure, absolutely. With working at Gensler, we have a core team of Fitwel ambassadors that are leading projects across various industries, different scales. And I think really the focus for us is, along the fact that we're working across different multiple asset types, from single tenant buildings to commercial interiors to kind of the base buildings and like multi-tenant retail and other types. I think one of the key things is really focusing I think this is important to our clients, is really the user experiences that they're having, and cultivating spaces that prioritize the employee, and that with the evidence-based, it does for spaces that prioritize the health and well-being of occupants. There is the enhancement of their quality of life and their impact. And the thought is the retention and keeping these employees. I think it's really competitive out there. And with post-COVID people coming back to the office, it is really something that companies are looking across to utilize certifications like Fitwel to retain their employees or to attract employees, help tell their narrative across to not only their occupants, but whomever their customers may be. But that is really key for I think our clients.
Great. Yeah, no, totally. And so please, everyone listening, welcome to add your questions here. We have a couple of questions to get us started. But as you're thinking about your questions, my last question is really around the future. So we've kind of talked about how the industry, how the healthy building industry has evolved over the last decade, how demand has evolved. I would love your 2 cents, each of you, on where you see the healthy building industry moving, what leadership is going to look like as we move through the next 3 to 5 years. Just as your personal perspective, that would be lovely to hear, like where you think, where are we off to as an industry? Nova, where would you like us to go as an industry?
Obviously, AI is a huge deal for everyone, and it's impacting all industries. I think just from my perspective, that the AI should just enhance, but not replace like the human experience. And I think as we increasingly, design or our work is focused on digital environments, the more that we do that, the more we need to humanize the experience, because the human needs won't fundamentally change. And I feel like the importance to embed nature into spaces or even outdoors where possible, where there's more access to daylight, connection with people, and reducing that stress around that. I think that should still be at core and essence of what we should be planning, and not forgetting when, AI can do a lot of things, but it can't really humanize. So
Great. Love it. Yes, please. More human prioritization, definitely. Moira, your thoughts on the future?
Totally agree with everything Nova said, but I'm just speaking from where I sit on the ownership side. I think AI helping us with further analysis and just connecting a lot of fragmented data and to connect the healthy design or healthy policies or whatever the intervention might be for human health at our properties to how that directly impacts certain financial performance aspects of the properties. I think there's a lot of exciting things to come on that horizon. So.
Great. Yeah, no, totally. And there's a question from somebody, Brian, thank you, an architect who's saying, how can we best encourage healthy building from our developer friends? So how do we have discussions encouraging healthy buildings with our developer friends? Perfect, actually, question for the two of you. How do the architects discuss healthy buildings if a client isn't coming to the table with it as a goal from the outset? Nova.
Oh,
Okay.
sure. Yeah,
Sure.
many a times, and we often do have the opportunity very beginning of the design stage, but even before we even jump onto the projects, there are opportunities for us to share kind of the benefits of a healthy building design. And in some cases, there are organizations that embrace having that, and it fits along with their objectives and goals and that sort of thing. And in cases where, they just want to get the project done and there's a time frame, it's always that balance of, we need to get this project delivered and, we've got this short timeline. And so a lot of times things like sustainability and wellness, if they're not integrated in, or sometimes, we'll see what we can add later. But I think it's really important. And what we try to do in the onset, we do usually have like visioning sessions with them and trying to just note that a lot of it is actually already embedded in the design. So it's just a matter of showing them, here are a lot of the strategies. These are the benefits, and this is how it relates to your objectives. And I think it's really tying in where their goals are. And maybe if you don't see them, it's still showing them like, look at how this benefits your business. This will also attract more employees or things like that we can share with them. But I think it's really important, key to have it early on in the conversation because it's harder to have these kind of conversations later. There's some jurisdictions that will require, at least from a green building standpoint, where they have to do, LEED to a certain level. And many times when we have those conversations, we'll also say, well, you can also do fit well, or, here are some strategies that you can accomplish that really complement each other. So again, that's just key to have those conversations in the beginning.
Great. And I think the last question, but I think it ties very nicely to the other, I'm going to give to Moira, because having been a real estate developer, being able to talk about the financial outcomes of any decision really is always persuasive. So at the beginning, we did mention the link between healthy buildings and financial performance becoming more possible. Moira, do you want to have the last word and kind of talk a little bit about, from your perspective, why it's more possible now to really speak about promoting health in financial terms and really connect these two pieces together?
Mm-hmm. Yeah, happy to. And I was going to joke about Brian's question quickly that if he knows who the equity partner is of the developer friends, if they're Harrison Street, you can just say that we are demanding fit well.
It's required.
Yeah,
So that's very
it's required. So know your equity partners. Yes, but yeah, to the question on the financial performance piece, I think There's already early research out there, and Joanne, I know you and your team know this, connecting specifically healthy certified buildings to higher things like higher rent premiums. And so I think our vision is to build on some of those pieces of research and specifically look at our portfolio, just because we have such a different property makeup. We're not in, traditional retail, traditional office, things like that. So I think there is a difference there. And I think that it'll be important to not only look at healthy aspects, but how those interplay with a lot of the other sustainable aspects of a building, and what the interconnections are and kind of what the special sauce is to move the needle on performance. It could be a combination of those things. It could be one thing very specifically. So that's what we are currently trying to tease out behind the scenes, and yeah, hope to share more soon.
Great, fantastic. Well, thank you both so much. Really appreciate it. I can't believe that 45 minutes has gone very quickly, but I really do appreciate your time, your expertise, leadership in the space. We can't do any of this without you. So we really do value our partnerships. And thank you again for showing us all what leadership looks like, what these amazing award-winning projects look like to inspire others. So thank you. Anyone listening or listening to this tape is welcome to get in contact with us. I'm always happy to talk more, but thank you again. And we will see you all very soon.
Thank you.
Thank you very much.
Bye.
Bye.